Hearing that we have cancer, a brain tumor, or heart disease makes us panic and spring into action. But our reactions are not quite the same when we hear that we have something like high cholesterol. That's because we don't realize how dangerous something like high cholesterol can be. Today on Medical Matters, we take a closer look at high cholesterol and how it can impact your life. So, you've done the responsible thing, had your health and wellness checks, and they've come back with the result that you have high cholesterol. For many people, this doesn't sound like something very serious or life-threatening, mostly because we don't understand what cholesterol is.
Cholesterol is a waxy, fat-like substance found in the cells of the bodies. It is essential for our bodies to have cholesterol because it aids in the production of hormones, vitamin D, bile acid that is also important for digestion. It also maintains cell membrane structure and integrity.
Well, now that we understand what cholesterol is and what its function is in our bodies, what does it mean when there's too much of it in our system? And what leads to high levels of it?
Having high cholesterol means that the LDL cholesterol is high in our blood. This is often referred to as the bad cholesterol. When LDL cholesterol is very high, this often leads to a buildup of plaque. This plaque is known as arterial sclerosis. This will then lead to a constriction of the arteries, and blood flow through your organs would also be greatly reduced, and it will have your risk of cardiovascular problems. Several factors can lead to high cholesterol. Genetics will also play a part in affecting a person's cholesterol levels.
We're also told that there's good cholesterol and bad cholesterol, which can be very confusing.
Good cholesterol is often known as high-density lipoprotein cholesterol, and then your bad cholesterol will be known as low-density lipoprotein cholesterol. So referring to good cholesterol, this cholesterol will often reduce higher levels of cholesterol out of the bloodstream, will transfer it back to the liver, and then will go back to the liver for processing and elimination. Then on the other hand, bad cholesterol will build up in the arteries usually, and then clog the arteries, and then your cardiovascular problems will arise.
If you're not the kind of person who religiously does those annual checkups, then it might be handy for you to know the signs and symptoms of high cholesterol.
Cholesterol doesn't actually show any signs that you have high cholesterol. It's often known as the silent condition.
Treating high cholesterol early enough sometimes involves medication and lifestyle changes. Often that involves the food we eat.
Statins are indeed the most commonly prescribed medication to treat high levels of cholesterol. Two dietary components to look at would be your soluble fiber and your plant sterols. These type of dietary factors would significantly decrease cholesterol. Various lifestyle changes can be made to reduce cholesterol levels. So you will look at a heart-healthy diet. This will usually include you cutting out saturated fats and trans fats, increasing your consumption for vegetables, fruits, whole grain, lean protein.
So yes, while cholesterol is a substance your body needs to function, having too much of it, especially the bad kind, in your bloodstream can be dangerous to your health. The good news is you can reduce the risk if you do what you need to early enough.